Hello everybody, your GP in Scrubs is back. I'm in the middle of the night shift. It's just 1:30 in the morning, and somehow the volume of the calls reduced. So I decided to take my break now and talk to you about body temperature, raised body temperature, fever, especially focusing on the pediatric population, so the kiddies. Becoming a parent is a stressful enough situation as it is, even if things go smoothly. A typical day with a little child could be just as exhausting as any night shifts in the hospital. So I completely understand when things go wrong, then it even increases the anxiety. However, parents are brilliant of managing things. We have simple things to sort out everyday problems. So if there's a tummy pain, we rub the tummy, we put some warm hot water bottle on it to help it. Drink some water if the child is old enough to drink water. If there's an egress, we have our plasters ready. If there's a fever temperature happening, then we have a bottle of Calpol ready or a bottle of Nurofen ready, and things all sorted, and life can go back to normal. However, I just wanted to get into a little bit deeper into raised body temperature and whether giving the Calpol or the Nurofen straight away would be the best idea or not. So taking an example, if you receive a letter of your vehicle tax reminder, what's the best next step? Beating up the postman? Well, not necessarily, but this is what we do when we just give the Calpol to the child. Sorry, when I'm talking about Calpol, it's a common brand name for children as paracetamol in an oral solution form. So sorry about mentioning a brand, but this is what most parents understand when we are talking about pain relief and reducing temperature. Calpol stands for paracetamol, but it's not specifically that brand. Any type of liquid paracetamol is normally called Calpol, just as we call the vacuum cleaner Hoover. However, you might have a different brand than Hoover. So yes, whether it should be an automatic response to temperature to give the antipyretics, the paracetamol or the ibuprofen, Calpol or Nurofen to the child, or is it like just beating up the postman? Because indeed, raised body temperature, fever, is a messenger. It tells you that there is an inflammation going on in the system. Most of the time in the children, the inflammation equals infection. Infection from a bacteria or from virus. And it doesn't really matter, bacteria or virus, the temperature can just shoot up. Your child will feel unwell, lethargic, stops running around, stops being naughty, just lying down on the sofa, not really eating, doesn't want to drink as much, and just generally feels poorly. And your heart is breaking. You want him to get better, you want him to get back to his normal, bubbly, playful self. So what do we see? Temperature comes on, child feels unwell. Solution then, bring the temperature down, child will go back to normal. Yeah, it sounds very easy and it makes sense. However, if you step back and take a wider picture, then you will see that the temperature is really just a sign of an illness. What we need to really understand why the temperature is there. What is the source of infection in medical terms? And you don't need to be a medical doctor to find out whether it's okay to manage the illness at home or whether it's time to call for the doctor. I just want to give you some simple tips what to look out for. So instead of the temperature, let's shift the focus to the real problem, which is the infection. In the preschool age group, the most common infection is upper respiratory tract infection, viral upper respiratory tract infection, which is cold. The average is about 10 in a healthy child at a preschool age, so it might sound like one after another, especially these are more dense in the winter months. So one snot clears and the next one comes. It's perfectly normal. This is how the immune system matures. So then if you see that your child has a cough, runny nose, full of lurky, watery eyes, red eyes, you know that it's a viral sore throat, it's a viral upper respiratory tract infection, a cold. It's a very innocent condition and it's okay to manage it at home. You don't need to call for the doctors. You need to look out for signs of deterioration. Two things. One is dehydration. So if the child is not drinking at least half of his normal daily milk, if he's bottle fed or breastfed, and if the child is not having at least 2 wet nappies. These are signs of dehydration. The other thing, the virus can spread to the chest in a form of a viral wheeze. It normally happens, the first one happens before the age of 2. It could be bronchiolitis or viral wheeze. It causes difficulty breathing. So if the child has difficulty breathing, then again you need to call the doctors. I will have a separate video on how to assess the child's breathing, but at the moment just remember these 2 complications, possible complications from a viral cold. One is dehydration, the second is a wheeze when you need to see the doctors. All the other symptoms could be managed at home. With or without Calpol, then this is the next question. Yes, you don't necessarily need to give Calpol to the child. You are not a bad parent if you don't give Calpol to the child. The NICE guidelines, which is what we work by, says that if the temperature is higher than 38.5 and the child is distressed, then you can give the antipyretics, preferably the paracetamol to start with. So if the temperature is higher than 38.5 but the child is sleeping soundly, you don't need to wake up and give the Calpol, because then it has no point. But if the temperature is lower than 38.5 but the child is distressed, possibly because he has a sore throat and not drinking, then it's a good idea to give the Calpol, because then it will reduce the temperature, it will reduce the pain, and you will have a window, a time window of 2-3 hours when the child is actually a little bit better, and then you can get him to drink something so you can avoid the dehydration. However, if the child doesn't have the typical symptoms of this upper respiratory tract infection, cough, cold, runny nose, watery eyes, temperature, then we need to find out where this fever is coming from. What is the source of the infection? Again, the second most common after this viral cold is ear infection and tonsillitis. typical with the tonsillitis, the child just has the temperature, strike on, no previous problems, happy child 1 hour, poorly child lying on the sofa the next hour. If they are very little, they might not even be able to tell you about the sore throat. Very similar with the earache. Sometimes they tag on the ear, they pull the ear, so you can have a clue that it might be an ear infection. But in this case, it's best to get them checked by the doctor. So with ear infection, probably you don't need any further treatment, but with the tonsillitis, if it's a bacterial infection, the child might benefit from antibiotics. Rely on your doctor's decision. If the doctor thinks that it's a viral sore throat, just go by it, but if the doctor thinks that antibiotics is needed, just follow that advice. Again, if it's not that, what else could it be? It could be a more serious infection, like a bladder infection or kidney infection. Young babies can get very unwell with kidney infections. Sometimes they need hospital admission with that. So that's a serious thing. We need to know about that. Sometimes high temperature and vomiting is the only sign of it. Of note, vomiting in a young child, not always a sign of an upset tummy. It's a very non-specific sign. It could be anything from ear infection to urine infection. So don't rely on that as a sign of an upset tummy. Again, another serious thing that's very, very rare is meningitis or meningococcal sepsis. Babies are vaccinated against it these days, which is great news, but it still happens. So if the doctor doesn't find any signs, any sources of infection, then we'll start to worry about meningitis. In a young child, you might not have the typical symptoms of neck stiffness, photophobia, headache. It might be that the child is just ill, just very poorly, high temperature, with no apparent source of infection. A pediatrician will need to see that child. A late sign is a skin rash. Again, I will do another video on skin rash in babies and young children, but for now just let's talk about the non-blanching rash, which comes with meningitis, but it is a late sign. So if your child is bouncing about but has a rash, it is not meningitis. So an ill child with non-blanching rash, it's an emergency. You don't wait for a call back from 111, you don't wait until the morning when the GP practice opens. You take the child straight to A&E because every minute counts. But it's very, very rare. However, still happens. I'm hoping to talk to a friend whose child had meningitis. Thanks God she survived. But it was a very, very traumatic event to the whole family. But I can reassure you that, again, it's very, very rare. So these are the common things, and this is how you can distinguish between a fever that's quite innocent and you can manage at home, or a fever that is a message about a more serious illness that a doctor needs to know about. How to manage the temperature? Do you need to give the Calpol or not? Well, you hear it from every GP, and you will hear it from me as well. We say that yes, you can give the Calpol, you can bring the temperature down, but we don't specify this message. We don't specify when to give it, when not to give it. We just need to give something to the parent's hand to feel somewhat in control. But please don't worry about the temperature itself. It's a normal reaction from the body. It actually helps the healing. I put down some articles in the description box that says no evidence, that any antipyretics, Calpol or Nurofen would make any difference in terms of how the child feels, how much the child drinks, any consequences about the duration of the illness, admission to the hospital. So the control group and the treatment group had exactly the same outcome. So the temperature has the nature of going up and down and up and down with or without the Calpol or the Nurofen. So we just need to accept that sometimes the best thing to do is to do nothing. What the child needs is a lot of care, just a lot of cuddles, just to be with him, just to stay close to the child all the time, because he will need mommy, he will need daddy more than the Calpol. Encourage them to drink, that's important. Monitor the nappies, we expect at least 2 wet nappies in 24 hours. If you are worried about deterioration, you can always call your GP or the 111 out of hours. Okay, I just want to share with you a few common worries that I hear from parents. So, as I say, generally parents are brilliant of managing the temperature because they have the Calpol, they have the Nurofen, they feel in control. Once the temperature comes down, they are more reassured, maybe falsely, because it doesn't count how high the temperature is. This is one very common concern, the temperature being very high, over 40, 40.2, 40.3, and the parents are worried that it might harm the child. There is no evidence whatsoever that any high temperature causes brain injury, heat injury, any other injury to the child, not even seizures. If a seizure happens, it will happen at the very beginning of the process of temperature rising, and by the time you measure the temperature, the seizure is already happening. It happens in susceptible children. Again, I'm hoping to do another video dedicated to febrile convulsions or fits in fever. Again, talking to a friend who had this experience with her son. So it doesn't count, it doesn't matter how high the temperature is. Second common worry, temperature comes back after the Calpol wears off. Yeah, this will happen. This is the nature of the temperature, as we discussed, up and down and up and down. You can expect this, no worries. The third, that the temperature keeps going up for some days, 3 days, 4 days, and then mother or father starts to worry that the child is just not getting better. Well, you need to know again about the underlying condition causing the fever. If it's a common cold, the snotty nose, then it will last 7 to 10 days easily, so carry on. Other things, I've run out of the daily doses. I've already given the 4 doses of Calpol. What can I do now? Again, the advice, chill out. You don't need to do anything. You allow the temperature to go up, and then that's it. It will come down on its own, and it won't harm the child as it is. I think these are the most common ones. I just check it here. Yeah, these are the common worries I can remember from parents. But as I say, best thing is to concentrate on the illness rather than the temperature itself, because a few hours history of temperature with a very unwell child with a non-blanching rash, you don't have a minute to waste. And a 5-day history of a child with a cough and runny nose, that's absolutely fine. I hope I could help you in a way to make sense about temperature, when to worry, when not to worry. If you have any further questions, anything like how much Calpol to give, whether to give Calpol and Nurofen together, whether you can alternate, whether you can give them together, any of these things, or what a temperature it is. If anybody is interested in the pathology of the temperature, I'm more than happy to talk about it. But I think this is the core message that I try to send out to parents regarding temperature. And then from here, as I say, we can move on to different illnesses causing temperature and just link it to this one. Again, any other questions, just give me a shout in the comments, and I will see you next time. Bye bye.